Hello there. Nice to meet you. My name is Marth, and welcome to my podcast. It's nice to have you on board. So, on today's podcast, we're going to be talking about a subject matter that is very controversial, but yet really interesting and useful in the medical field at the same time. And you might be asking yourselves, Marth, what in the world are you talking about? Don't worry, my fellow audience members, I'm talking about stem cells. And for those who might not know what stem cells are, don't worry, I'll tell you. Stem cells are a type of cell that are totipotent and have the ability to differentiate. You might, for those who might not even know what totipotent or differentiation means, I'll break it down for you. So, stem cells have the ability to be totipotent, which is a blank slate in nature. So the stem cell is essentially a blank slate. And the topic of differentiation means that the stem cell can turn into any type of cell desired, which makes it relatively useful in the medical field, especially in treating illnesses, ailments of sorts. So this ability of stem cells to be totipotent and have the ability to differentiate makes it really useful in organ healing, organ replacement, and neurodegenerative disorders. But first, let's talk about neurodegenerative disorders. But in order to start off talking about it, we need to know what plasticity means. So, plasticity is the amount of neurons you have in your brain and the amount of connections and how good they are in your body and brain. And basically, as you grow older, your plasticity or your neurons slowly start to disappear, which is not a good thing, which leads to neurodegenerative diseases such as Alzheimer's and even Parkinson's. And in going back to talking about stem cells and their ability to differentiate, stem cells have the ability to replace those lost or degenerized neurons, which makes it especially useful in treating people with Alzheimer's and Parkinson's. And this ability makes it relatively important and cool due to the fact that Parkinson's and Alzheimer's, they're not any type of illness to be cured easily. They take years and years of therapy and everything. But with stem cells, they can not be cured easily, but it's more efficient in terms of curing Parkinson's or Alzheimer's. And in regards to organ regeneration, stem cells have the ability to turn into the type of cells that you need to regenerate. So, for example, let's say my friend Jimmy got hit by a car. My condolences to Jimmy. And he damaged a vital organ, let's say the heart. And inside the heart, a bit of the tissue broke off and needs regeneration. Though the body can do it by itself, which would essentially take a lot of time in order to heal, stem cells can help the process of regeneration in the heart, which essentially could be the difference between a person staying in the hospital for a short amount of time as opposed to like a long amount of time. Short amount of time being around like a month to a long amount of time being 4 or 5 months. So it makes it relatively useful and efficient to heal people, especially like vital organs and stuff like that, stem cells. And the other ability of stem cells is its ability to reduce the amount of organ donors needed for patients that need organs, due to the fact that stem cells have the ability to make organs like freshly made organs which can be used in patients that need organs. So the tissue engineering concept of stem cells allow it to turn from just a plain stem cell in order to become like a cell that can be used for generation of a heart, a kidney, or even a liver, which makes these type of transplants more efficient, and people who are in need of an organ don't have to wait as long as they should. Because I was looking into the statistics, and a lot of people are in need of an organ, and a lot of organ donors have, like, sadly are unable to give those organs as effectively to those people in need. So stem cells have the ability to get rid of that, but it is not a current happening at the moment. It's going to take a couple of years for stem cells to reach that level. But stem cells do have the ability to generate into other organs. Though these benefits of stem cells might seem really nice, really useful, and you might be asking, there's a downside, isn't there? And unfortunately, in terms of stem cells, yeah, there is a downside. And the first downside is that the stem cells are harvested from fetuses and bone marrow in order to be produced. And you might be asking, okay, you said fetuses, so you mean dead babies? And I have to unfortunately say, yeah, stem cells are in fact harvested from fetuses, but there's an upside to it due to the fact that it saves more people, and those stem cells from the fetus can be used to help people in need of organ regeneration or neurological disorders, which makes it practically really useful. Another downside of stem cells is their genetic instability. And you might be asking, okay, genetic instability, what does that mean? And genetic instability basically means that your body rejects the stem cells and kind of attacks it through the use of white blood cells, and basically the process of regeneration doesn't go as needed. And you might be asking, isn't that dangerous? And I would say, yeah, it is very dangerous, and it is very unfortunate that genetic instability can occur to some individuals. But the benefits of this is that it doesn't negatively impact your body as much, and it just leaves you with the inability to fix that issue that you use the stem cells for. And lastly, but most importantly, another downside of stem cells is their ability to cause tumors through a process known as tumorigenesis. This basically means that the stem cells work super well in terms of regenerating an organ that regenerates so much more than what is actually required. So going back to my best friend Jimmy, who had a problem with his heart. So going back to his scenario, let's say he developed tumor genesis. So that basically means that the stem cells not only fixed his heart and fixed the problem, like with the scar tissue and the missing tissue, it also increased more tissue, gave more tissue mass, which is a very detrimental thing to happen to an individual. And this unfortunate circumstance leads to cancer, and that is a whole nother debacle. Though stem cells have the ability to regenerate organs, it doesn't always end up the way you intend, which leads to the formation of tumors. But it doesn't happen that often. It's relatively infrequent, but it is a risk that occurs when you use stem cells. A matter of fact is that if you use stem cells, it's there's always a risk to it. There's always a risk in terms of genetic instability, tumors forming through tumorigenesis, and the ethical concerns of it coming from fetuses and everything. But the matter of fact that it can be used to further medical research and medical treatments as like neurodegenerative disorders, tissue engineering as a whole, and even generation of organs makes it relatively effectful and relatively useful in this modern day. Though there are concerns among individuals that are like, oh, is it really worth the risk of doing this? You might go back and consider, okay, would you rather take this option, or would you rather just suffer there or just slowly die away? So this is this is the end of my podcast. But yeah, this is why stem cells are relatively useful, but there are detriments, and there's always detriments to good things. But yeah, stem cells, they're a relatively interesting topic and a whole can of worms, and it was nice having you on today's podcast. Thank you, and bye bye.